Hi guys. So I wanted to come on here to give you guys some updates and what's been going on and shed some light on my diagnosis here. So I was originally diagnosed with stage 3 breast cancer in 2017, and I recently found out in April of this year that it came back and it spread it to my liver and possibly my hip bone, somewhere in my hip. I don't know the medical terminology of it, but it's like iliopsoas muscle, which I have to do a biopsy of that soon. So, of course, with this disease, it's devastating. It changes your whole lifestyle. So it's September, and I've been in treatment. I've been having chemotherapy to control the disease. And so far, chemotherapy is going good. Sorry, I look a mess. Just because this is like the second day of chemotherapy. So, I've been crying. I've been praying. I've been talking to God about everything for the past 4 or 5 months. And it's just been a lot. It's been a lot. For those months, I couldn't make a video. I couldn't function. I couldn't talk to other people about it because it was just so devastating when I found out. Because my mind just went to the left. It went dark for those months. Having to deal with, this illness again, and then, my kids, that's hard for me to talk about because I they have to see me go through this, and they're older now, so now it's just a part of their routine now. They know mommy is sick. They know mommy's not working. It's just devastating. And in these videos, I'm really gonna be all over the place because that's how cancer is. It's your emotions are up and down, medications, side effects, scans, doctor's appointments. It's just a never-ending cycle. So my purpose of making these videos is to spread awareness about breast cancer and share my experience about what I'm going through. I'm not a doctor, so there's no medical advice. This is just only my experience, what I'm going through. So yeah, I get chemotherapy. I get 2 weeks on and 2 weeks off. So I went to the Fusion Center yesterday and I got chemotherapy. So far it's going well. I'm able to tolerate it. Yesterday I was a little bit nauseous. I don't know what that was about. But I did get like all of my pre-meds and stuff like that. And today is day 2. So I feel pretty good. I drank some tea. My husband's making me some breakfast. And then normally I would take Ativan for anxiety. I would take Zyprexa. I would take Decadron, which Decadron, that medication makes me like really hungry. It makes me eat a lot if I didn't have an appetite, but I feel pretty good today. Normally, when I first had this chemotherapy, I don't know, I was just, the anxiety kind of took over, and I was on Ativan for like every 6 hours. Now I'm on Ativan, as needed. So the anxiety part has gotten much better, because I was a hot mess. When I tell you, like, I was having panic attacks every night. I couldn't sleep. I was just panicking because I was just like, what is happening, right? I was just scared to do anything, scared to move, I was just scared just because, I didn't realize that I'm living with the disease, that I'm managing the disease. In my brain, I just went to the left, and you guys already know what the left is. If you don't know, I could tell you, but I don't even want to talk about that, because I've been thinking about that and dreading that, not being here for my kids and my husband, my family. That just devastating. It's devastating. But anyway, yeah, so I'm on chemotherapy. I'm on this hormone therapy. So I'm taking Zoladex. This month, I have no idea what's going on, because this month, I'm getting my period. I think I'm getting my period, and I'm panicking about that. So I talked to my nurse, my oncologist, and I said, I don't think the medication is working. This shouldn't be happening. I shouldn't be bleeding on Zoladex after like 4 months of use. And I'm nervous about that. So they ordered me to get a pelvic ultrasound. So I got to do that. Then I did request to take tamoxifen, which is another drug that stops cancer growth, potentially. I'm nervous to take that in addition to chemotherapy, but I'm going to do everything I think that I can to stop the growth of the cancer. So yeah, I have a pelvic ultrasound to figure out, why am I bleeding on Zoladex? Is it working? Whatever. Do I need to switch medications? Because my cancer it feeds off of estrogen. So if my ovaries are not shut down, that's a big problem. So I'm concerned that my ovaries are not all the way shut down, and it's like scaring me. So I did ask for tamoxifen as another medication, as a backup to help to stop the spread of the cancer or the growth of the cancer. Then, just to be on the safe side, I want to make sure that my brain is okay. So I have a brain MRI coming up. And then I have the biopsy of the hip coming up. So I have like all these tests coming up, and then I have my normal 3-month PET scan just to make sure all the treatment is working. So far, the last PET scan that I had showed, the liver is clear, the lymph nodes are clear, nothing's in my lungs or anything else, nothing's in my neck or anything but this hip. There's something there, and I just don't know what it is. It's not growing, it's not shrinking, it's not responding to the chemo. So I'm very, very nervous about that. That's why I had that biopsy, to figure out if it's breast cancer, or something else, hopefully a benign tumor. I don't know. It's 3 centimeters in size, and it's absolutely like just hanging out there. So it's just making me nervous because I got all this other stuff going on, and it's a lot. So that's what's going on now. So I'm taking, for chemotherapy, I'm taking I don't know if I was pronouncing it right, cisplatin and geminicin or something like that. Don't quote me. I don't know how to pronounce these medical terms. But anyway, it's treating the cancer in the liver. It's not treating the hip, because I don't know what's going on in the hip. So yeah, that's my update, you guys. That was a lot, and just, it's a lot. I got to the point in my mornings to where I'm not crying anymore, but I cry. I was crying so many times, and I was just like, okay, I have to think, how can I help myself right now without falling apart. But if I do fall apart, that's okay, because this is hard. But I'll keep you guys updated as much as I can as things go. Yeah, but I trust God. He's gonna get me through this. I love him so much. We've gotten so closer, because I was like, this is a lot. Like, life in general is a lot, but having a cancer diagnosis in small kids is a lot. So I'm just learning how to just navigate it all. And it's a wave of emotions. I can't even describe, like, how so emotional it is. But I'll see you guys in the next video.